pregnant women that are preparing to be pregnant at some point, I want to have a serious conversation with you about your birth plan. I know that birth plans are this really popular thing that women get very excited about because they want to be able to dictate their birthing experience. And let me just tell you, I had a birth plan written out of my phone. I kind of talked about it with my doctor, but two things. One, my doctor wasn't even present for my child's birth because she wasn't the doctor on call. She actually was the doctor on call the next day. Okay. Secondly, everything that I didn't want to do became a necessity once we started to get further into the birthing process. Number one, I didn't want Pitocin because I didn't want to speed it up. I wanted to take as long as we could take. Well, because I tested positive for group B strep and my water broke versus me just being in labor, I was open for almost too long without enough progress. So we needed to get the Pitocin to speed things up because then it would force said C-section. Well, I did end up having a C-section after pushing for 4 hours. The other thing was that because I tested positive for group B strep, there wasn't a lot of frequent examining to make sure that I was dilated a certain amount, because too much of that when you test positive for group B strep increases your possibility of infection. So as soon as you get into the hospital, they're going to put you on an IV, and that's going to help you prevent infection. The biggest issue with group B strep is that it's actually not harmful as long as it doesn't pass off to the baby. Blah, blah, blah. However, then at the moment that I've pushed for 4 hours and I've exceeded the hospital's policy on actually pushing, because apparently that's the limit that your body can take. Now, was I falling asleep in between pushing? I was. But was I adamant about not wanting to have a C-section? Absolutely. And then the more frustrating thing was the doctor was like, oh my gosh, I can feel her head. She'll be here in any time. She even gassed me up like, oh my gosh, I have to go do a C-section right now. Just go ahead. Continue to push. I believe that she'll be here before I'm done. She came back, baby, and that baby was not. Now, the thing that I just want to talk about is that when you're not prepared to get a C-section and the C-section becomes medically necessary, it's a very emotional experience that I feel like a lot of people around me are probably not going to agree with. I know people that have had C-sections, and a lot of them are like, oh, having a C-section, I didn't have a problem with it. It was cool. I know some people, they had a C-section. They weren't necessarily excited about it, but whatever. For me personally, it completely diminished the expectation that I had for like the first couple of hours of my child's life. So first and foremost, you're getting rolled into this room with a whole bunch of strangers that you don't know. Now, the doctor, I had one appointment with her, so I was familiar with her, but I actually didn't like my experience with her that day. Now, the day at the hospital, I feel like the experience was a little bit more pleasant. She was warm and fuzzy. What I learned months later is that she actually was probably like, I don't know, 4 months pregnant. So maybe the day that I saw her in the office, she might have been like going through her pregnancy stuff, and that just might not have been the best day for her. I don't know. Nonetheless, you go into this room, all these people are telling you all of these different things. So it's very chaotic around you, and you're like about to walk into one of the most monumental moments of your life. Your spouse or significant other or whoever your support person is not in the room yet. They are like prepared, suited up, they do all this stuff with them, and they're not in the room yet. So then they sterilize your skin, do all these other things, and then they bring that person in. But by the time that person comes in, to be completely honest, you are completely detached from the experience a little bit. You're out of control. You don't know what's going on, and you just have to wait here and wait for other people to give you direction. You can't feel anything either. So they're explaining every step of the process. I'm cutting the layers of skin. I'm doing this. I'm doing that. They pull the baby out. Obviously, the baby is still in a sack. I think, I'm not sure, but she was crying, so everything was fine there. There was a concern that she might have ingested some of the meconium, so they needed to like take her out and do all these different tests. Outside of that, there wasn't any signs of stress or distress or any complications or anything. They weigh her, they do all the necessary checks, everything pans out. And then they bring her to me, and again, I'm like stretched out. My arms are stretched out. There's not much that I can do. I can't really even hold my baby at this point. And I'm really emotional about it because I feel like my husband was able to like get like those first seconds of like, let me hold my baby. Meanwhile, I didn't, whatever. So then the baby and the daddy left the room. They have to like close me up. So I'm still just kind of laying there. I remember being cold. They get me blankets. I remember like I started to like shiver, like a very cold shiver. And then you're just, again, just sitting there waiting on them to finish sewing you up. Then you're reunited with said baby and your significant other. And at that point, they actually had to do skin to skin with me because the baby her temperature wouldn't like stay one way or the other, and that is one of the ways that they do that. In addition to that, they also wanted to try to get me to breastfeed her, and that worked well, and we didn't have many other issues after that. The healing process is very ghetto because you go in there thinking you can walk out, and you do walk out, but you just walk out differently. The first 12 hours after your surgery, very crucial. I didn't know this until recently, that like having a C-section actually increases your chances of possible mortality. No idea that that was a thing. Nonetheless, they're like around the clock checking you, your blood pressure. They're checking all of your levels. They're also checking like blood in your urine as well, because that can be an indicator of something. They have these things on your feet that are constantly making sure that your blood is circulating, because you can't walk for like the first 12 hours. And then after the 12 hours, there is this push for you to like provide a certain count of ounces of urine, and they want you to get up and do stuff. And then you have your baby that needs you. You just want to snuggle with your baby. You're very uncomfortable anyway you sit, anyway you do anything. And then you go home. And then it's just like whatever. And in a lot of ways, again, I feel like everybody else just accepts C-section as an option. But if you go into your labor thinking that everything is fine, there's no possibility of a C-section, and having to have one, if I'm being completely honest, the emotional spiral that happened the seconds before my C-section, the nurse and the doctor actually stepped out of the room because I was yelling at my husband. I'm gonna be completely honest. I wasn't necessarily excited about anything. I wasn't necessarily excited, interested, anything of the sort. So because of that, I want to encourage all the currently pregnant mamas and all the women that will become mamas, please be open to the fact that your birth plan could actually diminish in seconds based on whatever medically necessary decision occurs.